sitting at the table with some phenomenal women, Black women in white coats. That's right, you all. We have two amazing doctors that are here with us, and we're going to have a lively conversation about health disparities, this pandemic, and what we need to do to make sure that we are saving ourselves. So I want to introduce you to the amazing Dr. Dawn Robinson. I'm going to let her introduce herself. And I also have at the table with me, oh my God, the phenomenal, amazing, Dr. Cheryl Dixon. So I usually call you by your whole name. I'm not going to do that to you today. But Dr. Dawn, would you please take a minute, introduce yourself, kind of the scope of your work, and let the audience get to know you a little bit better?
Hello, my name is Dawn Robinson. I've been practicing in Michigan since November 2010, but I've been a practicing OBGYN for almost 20 years. I started my career in Georgia, then I moved to Dubai and Utah, and then I've been in Michigan subsequently. So I am born and raised in Colorado, not from Michigan, but I've been here a decade. I enjoy women's health and delivering babies. I consider myself an advocate for my moms and my patients. And right now, it's important that we educate ourselves and educate our patients so that we do what's right to keep ourselves safe.
So is gynecology your specialty?
Obstetrics and gynecology, both.
Absolutely. You are, oh my God, I'm just so excited to have you here with us today. Cheryl, Dr. Dixon.
Yes.
Talk to us.
So, hi, everyone. I am actually new to Michigan. I've only been here, well, it'll be 6 years in October. And I love this community. And I am a practicing pediatrician as well as working at the medical school. And at the medical school, my primary role is I'm the Associate Dean for Health Equity and Community Affairs, which means that I connect with the community and have the medical school connect with the community in a positive way. To actually look at things that, they can bring to actually help to better the health for the community. So I also am very involved in education of that next gen of medical students. I think that's really important because we really want to make sure that students know about disparities, they know about what health equity means, and that they actually understand about biases and things that they bring to the table so that they can really care for our population in a way that we should be cared for. So very important to me. I've spent a majority of my career really in academic institutions, but everywhere I've also seen patients. Always love seeing my babies and my family. And so I've been in practicing pediatrician for like over 20 years. I'm from New Jersey, and you now can pick up on the New Jersey accent after I always say it. So been in New Jersey for over 20 years and then came to Kalamazoo and for this role, and actually have partnered with organizations. I work with Mothers of Hope, and I love this community. And I really want this community to do well. So I'm committed.
So we have quite a bit of time to talk about a few things, but I would be remiss, Dawn and Cheryl, if I didn't say the amazing opportunity for the community to see you, where we have such great diversity and inclusion, and especially aspiring young women and girls that are looking at what they want to do in the future, and to see two phenomenal Black women in white coats that are on the front line, saving lives, delivering lives, I think is a testament to the growth here in Kalamazoo and our region, and to show young girls that yes, you can, because they already have. So thank you for that inspiration. So I want to talk a little bit about this pandemic. What's happening here, and what are some of the really, really important things that we need to know? We're already talking about the washing our hands and the social distancing. We're already talking about covering up our face and everything. But as a community as a whole, there's just some other things that we need to really make sure that we're touching into. What do you think, Dr. Robinson?
Well, I think those are the most important top three. First of all, listen to your government, listen to your local and state government in the guidelines. I think social distancing has flattened the curve. So we've not seen the spike that other cities and states have seen. Our health systems have been revving up and getting ready for the surge, but thankfully so, we're going back in kind of a standby mode. As healthcare systems in Michigan, some of us are starting to open our practices and starting to schedule surgeries. But the key things are the social distancing, the mask, and the washing of our hands. We have to support our elders. We have to support our seniors, get out and support them as we can, remind them that they can have groceries delivered, they can do church service on the internet. We don't have to be out there. And I think the message is confusing because some states are opening, luckily none around us. Amen.
Amen.
I have many family members in Georgia, and my oldest son is in Florida, and I'm praying by the moment and reiterating to them that it's going to be more dangerous every time they leave their household. So we do not know where this pandemic is going to take us, but it's going to be with us for many, many, many months. So as long as you can stay in the house, my sister, my niece haven't left the house since March 12th because I've had them on lockdown and I only leave for groceries and work. So you need to take it seriously. You need to wash your hands. They're not really recommending gloves because with gloves, we feel extra secure and safe and we start touching things. So the main thing is hand washing and sanitizer. If you don't have sanitizer, old-fashioned soap breaks down the virus just as well. And please, let's reiterate, no bleach, no disinfectants need to enter your bodies because it does not cure the virus. It may kill you or harm you and put you in the intensive care unit.
Thank you for clarifying that. I want to ask you just for a clarification. We hear that term flattening the curve,
Yes.
right? Can you explain to us what that really means?
So if we had not stayed home as a state, our curve would have kept going like this. Mm-hmm. And the west side of Michigan would have been hit like the east side of Michigan. But because we listened and we stayed home and we took the precautions, we are now flattening the curve. So the west side health systems, instead of being in orange and red mode, we're now tampering down to get back to the normal, the new normal. It's never going to be normal the same, but the new normal of COVID-19, which means sanitizing stations and mask stations at every practice, which means patients sitting in their car until it's time for them to come in. There's so many precautions that are being taken. So by flattening that curve, we have avoided overwhelming our healthcare systems, at least on the west side of Michigan is what I'm speaking for. The east side of Michigan is recovering, but they've seen a flattening of the curve. And thank God Governor Whitmer has extended our stay-at-home orders. I hope she extends it through June 1st. I just want as many of us to be safe as possible. Especially our pregnant moms are very, very worried, very, very concerned. Luckily, the healthcare systems are getting access to test and going to be able to start testing our mothers on the OB units so that we can reassure them that they're less risk to them and their newborn and also less risk to us. So we're definitely taking steps in the right way, but flattening the curve has been successful because we've listened to our governor and our leadership.
Absolutely. Dr. Dixon, so we're seeing a lot of reports, right? We see the numbers are growing every day. We see the number of people that are infected with the COVID-19, but even deaths. And now we're getting these reports that African Americans especially are at even a greater risk of being infected and or even dying. Can you talk to us a little bit about that? Is that because we are just out there more or because there's other underlying issues?
So actually, what COVID has done is it's actually now shown, I call it a mirror or a magnifying glass to what has always existed. Our community has suffered from health disparities and health inequities all along. It's historical, it's generational, it's from all of the policies and all of the things that have happened that have made us as a disadvantage. We also, when we suffer with a chronic disease, we suffer more with higher morbidity or mortality of those chronic diseases. What I'm talking about is high blood pressure, diabetes. You're more likely to have a kidney transplant, or you're more likely to lose a limb if you have diabetes and you're African American. And again, these are disparities that have existed and have continued to exist. And so what COVID-19 has done is made a magnifying glass on our mirror to what really is something that's status quo in our community. So given that, when we look at who's at risk, the people who are at risk, of course, highest risk for being really sick with it, although we do see young people getting it as well. People that are young and otherwise okay have gotten sick and also died, but not to the same extent as older individuals or those who actually have chronic diseases. So when we already have more of the chronic disease, higher morbidity, and again, the living environment of what we have in terms of access to care, prevention, all of those things, actually now you put a virus, the COVID virus, you're more likely to get it. And you're more likely when you get it to suffer, to be sicker, and to die. And that's actually what we see, is that it's a higher death toll. The statistics are important for us to look at and really look at who is dying, who is getting it, and why are they getting it. And again, it points to the inequities and the racial disparities that have existed. Mm-hmm. And so it really should make us look at, hopefully it will make us really look at what we're doing and what we've been doing in medical care to contribute to that, to actually say, what should we be doing? How should we be looking at our policies, which we should have been doing all along, but now really let's look at that to see what we need to do to change. So those are the things that, I think that when we look at what's happened to impact our community, even going to, I agree with everything that my colleague Dawn has said, access to protective, equipment, the mask and all the things that we're saying, that you should have that actually can protect you. So we look at the workers, the people that are the essential workers, right? The bus drivers, taxi drivers, grocery store clerks, all the people, those jobs, again, are likely to be from our community. Mm-hmm. And not until recently did they actually have the shields up, tell them to wear masks, put them on the gloves. They were out there, right? So they were getting exposed. And they weren't really getting a lot of the protection. We were going back and forth with, do you need a mask? Do you not need a mask? Only people that need a mask are the healthcare workers, not ordinary people. They needed it because they are front line. And they are front line, again, more likely to be exposed. So those are the things now that we're seeing. And, I'm glad that we see it, that there's the protection for, those workers. And also the call for mask. So that's the other, is that access. Does everyone in our community have access to masks? And if they do, are they wearing them? So important. So important that masks are worn. And that we are giving those out, and that we are giving that message as something that's important to do. The other thing I think is important is, yes, we need to be staying at home, but with that staying at home, mental health is important. So what are the kinds of things that you're doing to keep yourself healthy mentally? Because this is hard. It is hard. It is hard. It's been hard for me. And no, it is hard. It is, and it can get to you. So you have to stay connected, staying connected on, if you can, with FaceTime and other things to do to keep yourself mentally from getting depressed, because it's hard. I think exercise is important. Some form of exercise, again, walking, or if you can, with your, safe distancing, but doing something. There's things you can do online, and of course, eating healthy foods. I know it's hard because, you're home more and you're going to tend to snack on all those things.
Oh, Lord, I have.
I tell me, I can't buy a bag of potato chips because it's gone in a day, a bag like this. Oh, and it's just me just eating them, because I know. So those are kinds of things to be wary of, because if you are not careful, you're actually adding to things that actually will impair your health later on. So you really want to fruits and vegetables and those kind of things, try to stay, with those. And the other thing is, and I'll stop, is testing. So I'm so happy that now there's more testing available, and that testing you can get more rapid results. And Mothers of Hope has really helped with, the Family Health Center, the drive-through, and the numbers of people that actually now have gotten tested. there was restriction in the beginning of who could get tested. And there were people who were going to the hospital sick and weren't getting tested and sent and died.
Absolutely.
We've had cases that we've talked about, you and I, Stephanie, that, just break my heart. But, now shouldn't happen. They are testing, like they opened up now, my WMed clinics now do testing too.
Mm-hmm.
So if you think you need a test, you need to call that number at the Family Health Center, or you need to call that number at WMed, or you need to call that number at the health department and say you come in, you want to go for that drive-in or that walk-up, because now it's also walk-up testing because you think you need to be tested. Mm-hmm. Really, really important. Because again, if you have it and then you're around others, that you can then, impact them. And I know we love our families, but we have to look at who's vulnerable. Mm-hmm. So our elders are more vulnerable. Those with those chronic diseases, we have to really look at being really careful around them. You love your grandkids and all of those, but again, they're pediatrics. They can get it. They won't be as sick. They'll get like a cold or something, but they're carriers. Mm-hmm. So they can love up on their grandparents, and the grandparents will get really sick. So you need to remember that even though you do, and I'm a hugger too, I understand. You want to hug them and you want them to be like, you got to, respect that and keep the distance and not to visit. Make those visits be virtual to kind of protect those people we know in our family who are vulnerable.
Well, I want to jump right in there, Dr. Robinson. Go ahead.
Is the testing still in Kalamazoo County only for symptomatic people? Not everyone.
So they have expanded that to essential workers that are, that are still working. And if you are, even if you are asymptomatic, you still can call and make an appointment to do the drive-up testing and or the walk-up testing. But so I know that the
workers only.
Huh?
For essential workers only.
No. So anybody can call
and
do this pre-screening through the Family Health Center. Their medical doctors are doing the pre-screening, and then they set you up an appointment. But at first it was, if you were asymptomatic, you could not, they would give you another alternative, but now they have opened that, they have expanded that you can, if you are asymptomatic and you are an essential worker, you can get the test. And definitely kudos to Denise Crawford, the CEO at the Family Health Center, who led the way, of making sure that she provided health access and testing for everybody, especially to the most vulnerable population in our community. I have a couple questions for you all, even though Dr. Dixon covered a lot of my questions, but that's okay. That's okay. I love all the magic here. I wanted to have the two of you here to basically clear up some myths. There are some myths that I believe that are in the community, particularly our community, that I wanted to get on board here. But before I get to that, I wanted to tell you that my viewing audience is very diverse, very inclusive. And although we talked about issues that impact people of color, I want to make sure we hit on the LGBTQ and especially the transgender community and the impact that this pandemic has with that population of people.
Well, I think a key issue that Dr. Cheryl touched on is mental illness and mental wellness. And those groups already feel isolation before the pandemic. So we have to make sure that we're staying connected. Taraji Henson's foundation 2 weeks ago announced, I believe, that they're doing free healthcare for African-American people in the country.
Oh, wow.
So I think we have to make sure for those groups who are already marginated based on their decisions and their loves and how they choose to live their life, which I disagree with, because they're already marginated. If you have those individuals in your life, you need to make sure that you're reaching out and you're staying connected, and you make sure that they're not isolating and being alone, because this is a critical time. The transgender population in America, especially African-American women, were, last year, it was just, I lost track of the number of transgender African-American women that were murdered.
Yes.
So it's such a high-risk population, and they're so isolated that please reach out to those in your community to support them through this difficult time. It may only be virtually, but you can still provide that support.
Dr. Dixon?
So I was going to say, I echo what Dawn has said. And I also particularly look at the youth, right? Because when we look at transgender, the transgender youth and youth who have come out to their families are often put out of the house. So there are a lot of homeless youth out there. And that then brings me also to the homeless population, because those populations are really at risk. You talk about staying safe, staying home, staying away from crowds, but how can they do that, right? So one of the problems, particularly with the LGBTQ, particularly T, transgender youth, is one of the things that I'm most concerned with is that homelessness that they have. Yes. So again, looking at organizations that do make a difference, like Out Front Kalamazoo, supporting those organizations, because they do support. They do the support for those individuals in this community. And just like a lot of organizations that are needing money, they need money to actually help to do that. So we need to consider that, and consider when we're talking about who needs some of the more resources, or how ways that we actually can better help. I think that sometimes we don't think about that organization. We need to. I know I do. Part of the call for me with health equity, and that's about health equity. They suffer as well as the African American population and populations of color with disparities. Absolutely. And a lot of those disparities are caused by lack of access, or when they get access, discrimination when they're access, so they don't go. And then also the other things that I just talked about with societal isolation and societal things that make them even more self-isolate.
Well, let's talk about dispelling the myths. Myth number 1, melanin, the brown skin pigment, protects African Americans from COVID-19.
Non-truth, not fact, not proven. We are susceptible, just like some brown people believe we can't get skin cancer. That is also false. Our human body can be injured and suffer all consequences of COVID, as we see, because we have significant mortality in cities, counties, and states where we represent a smaller percentage of the population, but we're the ones dying at a higher percentage. So please do not believe the hype.
Dr. Dixon, myth number 2, COVID-19 is only affecting the elderly and those who have underlying previous health issues.
Not true, because we actually are seeing, like I said earlier, younger people, middle-aged people actually have been reported to get COVID and actually have died. So maybe the incidence of death isn't as high, but they do die. Even college students, like one of the things that we have seen and heard is also even college students have gotten COVID and gotten really very sick. So if you look at the statistics and data, sure, it's skewed. It shows more of that population that dies and gets really sick, but then it doesn't mean that you don't see it in the younger population as well.
Absolutely.
So New York is now reporting on young people coming in with strokes, because the COVID, besides affecting your lungs and giving you headaches and fever, it's also causing a clotting abnormality in our system. So they're thinking it's affecting the kidneys. They're now even talked something about COVID toes, where the blood clots are affecting blood flow to the toes, but they're seeing 30 and 40-year-olds coming in with strokes and COVID.
Oh,
so
my.
It's affecting all ages. Thankfully, not the babies we've seen so far.
Exactly.
As Dr. Cheryl said, the kids can be carriers. So I have friends that are hanging out with their grandbabies, and I just pray. It makes me nervous because they have risk factors that every time they hug and kiss their grandbabies, they could be getting COVID with every kiss. Wow. So yes, it's affecting all ages.
Absolutely. So myth number 3 for both of you ladies, African Americans are predisposed to COVID-19.
Not true. Just that, like we talked about, is that we have a higher incidence. Yeah. And again, we have a higher incidence due to all the inequities that are in the system, and our health inequities to start with. We already start with having a higher rate of some of these diseases that we just talked about. And also higher social determinants, lack of things that are important, housing and, employment and access to care and all of those things. So.
And remember, when Cheryl first spoke, she mentioned other medical conditions such as hypertension and diabetes, but asthmatics are at high risk. That's why my niece and my sister have been locked down because they're asthmatics. So people who are, and I'm trying to encourage my nieces and nephews and family members to get their asthma and my oldest son well controlled so that your body's breathing as healthy as it can, during this high risk time period.
So let's talk a little bit about advocacy. What should people expect, Dr. Dixon, when they go to the hospital? We're going in alone. Your spouse, your children, your advocate can't go there with you. What should they know? What should they do?
So hopefully they're able to have called to get a test first. But again, if you're sick, you're sick. You need to go and be seen. Mm-hmm. And so when you are seen, that I'm hoping that you're not turned away like the stories I had heard, because now we have more, and that you will get the test. But I think it's important that you advocate for yourself always. You ask questions. You need to ask questions. If you are not happy with what someone has told you, or you're still unclear about what they've explained to you when you're going for a cough or a fever and you feel uncomfortable, you have a voice. Make sure that voice, you use it and you say, I'm not comfortable. I'm not sure I understand what you're saying. I would really like to know if I can have the test, or do I need the test, or why not, so I can be clear. I know sometimes when you're really sick, it's hard. It's hard to advocate for yourself when you're really sick, but you need to. And I also suggest that sometimes you have those questions because, if you're going and you're frightened because you have some cough or something or shortness of breath, and you really just need to be seen, and you don't really have a provider you can call. Like, we know we can call the Family Health Center, we know we can call WMed, we know we can call, but if it's like 3 o'clock in the morning, 2 o'clock in the morning, you're frightened, you need to be able to be seen, is you need to make sure and you're going by yourself, try to write down like what I really want to make sure I want to ask, so that you don't forget, so that you do get that answer. It's important because often you leave, and if you haven't had those questions answered and you don't speak up for yourself, you may not get the care that you need to get. And when you go home, you may not back, because that's the other thing. What we're seeing is that because of the experience that maybe you had, you're like, I don't want to go until the last minute. I don't really want to go because they didn't treat me really well, or I didn't like the way that I was treated when I went last time. So I'm not going to go unless I really absolutely have to go. Please don't wait, is my mind. Please don't wait until it's that late. If you feel sick and feel you need to go. You need to go and get that addressed. Don't wait until you almost have to be carried in to go, because at that point it may be too late.
Yeah. Dr. Robinson, we have women who are pregnant that are looking, having to deliver their babies during this pandemic. What should we tell them?
Well, first of all, it's important to keep attending your prenatal visits. During this pandemic, obstetricians and all specialties have quickly moved to telehealth appointments. So we are seeing some low-risk patients through virtual health. But for late pregnancy women that are beyond 35, 36 weeks, we are still seeing them in the office and seeing them regularly and encouraging them to continue care. As I said, some healthcare systems do have access to COVID testing. So we are testing our patients upon admission to the labor and delivery unit to also reassure them. But we're taking the same precautions in the office. In the hospital, everyone wears a mask now. Nurses, doctors, janitorial staff, administrators, patient, and their one support person. And we're trying to protect each other. Right now, the science that we have to date has not shown that we're at increased risk of getting it, but when we're pregnant, we can have increased complications like the flu. When we get the flu when we're pregnant, it can be very dangerous. So we are encouraging patients to deliver in hospitals. Even during the pandemic, hospitals are still a healthier option than home births, because there have been many people and many advertisements across the country that women are considering home birth. Babies are 4 times more likely to die in home birth situations. And when women come in from home birth situations in critical conditions, we are already behind the 8 ball because so much has happened at home and they're already coming in near death. So please deliver in the hospital. We're there to take care of you. We're there to reassure you.
And I'm assuming both of you women are champions for doulas.
Yes.
So I think that we've done an incredible job of really giving some empowering information and dispelling some myths. Let's talk about how we inspire the community to really be resilient through this. So let's give some encouraging words that we're going to be okay, right?
Well, our roots, our history tell us we're going to be okay.
Yes,
we have not lived 400 years through the strife and the racism and the slavery and the rape and the Tuskegee experiments and all the things that have happened to our people. We're going to be all right. And we will continue to lead and keep the faith, keep the prayers going up, and wash your hands and wear your mask and social distance. Social distancing, they think, is going to be with us through next year and maybe even longer.
Absolutely. Dr. Dixon?
I agree. I'm a woman of faith. And so I believe in prayer. And I know that, our church is virtual. So I think that's another way of staying connected. I think we as a people have been a people of God. So we actually believe, and our faith has kept us strong, as well as our community. We are also we come from tribal backgrounds, right? So we actually do well as a community. We help each other. So I think that that's the other key is helping each other, reaching out and knowing when someone needs help, needs something. We are resourceful. I mean, I just look at some of the, Facebook. I'm not that great on Facebook, but I look at some of the things. Steffi's gonna help me. Some of the things on Facebook that people are making masks and showing what they're doing. And so we are resourceful. We are a community that helps each other. We are faithful. We are of God. And I'm gonna echo what Dawn said. We are resilient. Look at what we have gone through, and look at where we still are. We still are here. I'm still here. We're still here. And despite, I just think that despite some of the stuff that we have to go through, we make it, right? I mean, Dawn and I can testify that the two of us sitting here, I don't know how long you have. We could talk about stories, right? I mean, and every one of us, like us, is 2% of women in medicine are African American women. 2% in the country.
Wow.
2%, and there's a reason for that. But we are here to help others come along that pathway, and it just shows that we can get through this. We cannot lose faith. We cannot lose our faith.
And you pointed that out, which is wow. I mean, that's a number that is like, okay, let's go round up all of the sisters and send them through this pipeline to end up wearing white coats as well. But another proud moment is the young woman who is leading this issue at the state with Governor.
Amen. Yep.
She is, I mean, where you look at where we're getting real change, where the conversation is on the table and at the heart of it is equity. Yeah. And where we are forcing the work towards equitable policies, it's where women, particularly women of color, Black women.
Yes, ma'am.
So we can't get weary in doing good. So I'm glad that you two are inspiring us and each other. And that we just keep on keeping on, because one of my favorite scriptures, Dr. Dixon, is I was once young and now I'm old, and yet I have never seen the righteous forsaken us. So,
and I agree with that. I actually also want to say, when we talk about women leading, there's a doctor I'll send to you all. I'm just so proud of this woman. She is 32 years old. Her name is Dr. Kazamika Corbett. And she's actually on the front line. She is actually in Johns Hopkins. Mm-hmm. She's one that's actually that the president and Fauci.
It's okay. She'll come back in.
While we're pausing there, when we were talking about advocacy, you can't take someone in with you, but make sure your phone is charged, and make sure you take your phone charger, because
That's a
there's
good
been
point.
many a time I've talked to the emergency room doctors and pediatricians on my sister's children's behalf or her behalf on a phone. So if you can't say what you need to say, but your niece or your cousin or your aunt or your uncle can speak more clearly, then you demand, don't even ask, pull them up on your phone and turn the phone to the doctor and let them ask the questions.
Yep.
Because that's what a lot of the systems are doing now. They're allowing the virtual visits.
Yeah. Well, I can tell you, I experienced
And
it
that's a great point. Yeah.
I had a loved one, a very close loved one. I don't want to respect their privacy, was hospitalized during this pandemic. And definitely trying to advocate and talk to the nurse and the doctors and ask questions. And at one point, the doctor was frustrated. Like, why are you asking me about this individual? And I was like, because I love them and I want them to live. And by the way, where's the answer to my question? So that is real. And my loved one was at a point where they could not advocate for themselves. They were really, really sick. And so to be very insisting on communicating with the hospital staff about the well-being and what's happening, what they're doing with your loved one is very, very important. So even if they feel like they don't want to communicate, you insist, you demand it.
And this is an important reason I got all my documents in a row a month ago, is make sure your durable power of attorney for healthcare is in order. So that person on the phone or video chatting, if you're unable to fight for yourself, that person is your legal representative to fight for you when you can't speak for yourself.
Good point. Absolutely.
Absolutely. Dr. Dixon, you went out a little bit when you were talking.
Oh, I was going to just a shout out for this doctor that's actually, did you hear me? Who actually is on the verge of making the coronavirus vaccine. Kismika Corbett.
Okay.
And she's at Johns Hopkins. She's working on, she's a scientist and she's working on the coronavirus vaccine. And if you read this, I'm going to send it to you because everybody needs to know about her. She's an inspiration and also a woman of faith.
Absolutely. And so our Surgeon General is
right.
Yeah.
And what about the twins? What about the twin doctors in New York? One's on the public health side and one's in the emergency medicine side. And the person in charge of public health in Wisconsin is a sister. She got elected a few years ago. And so I don't do Facebook, but I do LinkedIn. And a couple times a week, we are all stepping up and we are being represented and we're becoming CEOs and COOs. And if you read the articles about the female leaders of the world, how Germany and New Zealand and Taiwan and Iceland, some of these people have single-digit numbers, single-digit deaths. But I've been saying for years, if women and children could rule the world, we'd be a better place.
Yes, yes, yes.
Those leaders are showing how it should be done.
Yeah.
Yes.
And getting it done.
And getting it done. So ladies, it has been amazing talking to you. I'm so grateful that you chose to join me at the table. Shirley Chisholm said, if they don't create a space for you at the table, bring your folding chair.
Yeah.
Well, for a while, I brought my folding chair and then I just made my own table. So thank you for being here. You are an inspiration. You all are doing amazing, phenomenal work, and we need you and we appreciate you. So please continue to take care of yourself and your family so that you can continue to support us and lead us through these challenging times. I want to give you both a last word before we wrap up.
So Stephanie, I want to throw that back at you. I want to tell you how important it is to do what you're doing. I talk about you all the time, but just like even this MOOReTv, actually you are able to reach the community and reaching out to the community for important issues and to be able to have, bring these platforms. This is what has to happen. And so I champion you for all the work that you're doing and the voice that you have and the commitment that you have. And you are a sister who I'm like so happy that's in this community and that's in this world. Because you make a difference. And, so.
To God be the glory.
Thank you. Because again, we will make it through with people like you and things like this that you're doing.
Thank you. Dr. Dawn Robinson.
Be safe, social distance, wash your hands, and we're going to make it through.
All right. Well, that's it, you guys. You got the greatest information today at the table. I encourage you to continue to tune in to MOOReTv. We'll definitely have Dr. Robinson and Dr. Dixon to come back because we got a lot to talk about. We got a lot to deal with. So again, thank you, ladies, for being here, and have a wonderful day. Stay safe, stay healthy, and continue to praise God.
Yeah, praise God. Thank you. Bye-bye.
Bye.